And doctor, you say you see patients who you believe are probably positive, but you can't get them tests. Tell us about what it's like for you in that situation. What protection do you have when you are seeing these patients who you won't even be able to test, and therefore you won't know what you were exposed to?
Yeah, because of the minimal numbers of N95 masks, I think across the country we're hearing, certainly in our state, within our hospital. We're wearing, paper masks. We're wearing goggles and gowns, reusable gowns and gloves, and we're, using procedures that we've trained for at the doorway to limit exposure anywhere else in the hospital. And yet, we have a certain number of surgical masks, really not adequate for this type of virus. But we only have a limited number of those, so we're being told to save those throughout the shift and only replace them if they get soiled or if they get moist. And again, this is not the fault of individual hospitals or individual states. This is federal lack of response. We feel like we're really being let down by our federal government, who has the capability to get us the equipment we need, and they're not doing it.
Doctor, how do you make that personal decision? You know you need more protection in the work you're doing, and yet you decide to stay and you decide to seize patients and have patients walk in who may be positive for coronavirus and deal with them. There's another choice, which is to say, I'm not going to do this work at this time. It's too dangerous.
Yeah, myself, like so many in this committee that I run, hundreds of doctors across this country and really everywhere. And, this was a calling for me. I've been doing this for 20 years. I've been serving the community that I serve for nearly that amount of time. And you feel a sense of responsibility also to your team members. We have nurses, we have respiratory therapists and x-ray techs, and all of us are at times throughout our jobs putting ourselves on the line. We do that in the emergency department with violent patients, with other pathogens, with erratic sleep schedules. And now, we're doing it with the coronavirus. The unfortunate thing is we feel that the federal government could do something about it. They could fully enact the Defense Production Act and get us more N95s, get us more protective equipment so we're not putting ourselves on the line.